Hello, everyone. It's May 17th, and over the weekend on the numbers that we have, and we're always cautious about the weekend and everything, but we've had 6 additional deaths, and you know, it's terrible to think about 6 great West Virginians we've lost. We know that, but 6 is a heck of a lot better number than what we've been having, and it just continues to get little by little better. But again, out of all the respect and honor that we can give these people, we want to read these people. But our 2,757th death is a 78-year-old female from Mineral County. Our 2,758th death is an 81-year-old male from Wood County. Our 2,759th death is a 73-year-old male from Barber County. Our 2,760th death is a 65-year-old male from Cabell County. Our 2,761st death is a 59-year-old female from Marion County, and our 2,762nd death is a 64-year-old male from Putnam County. Again, please don't let them become a number. Absolutely, absolutely. Keep all these people in your thoughts and prayers. Some way, somehow, they know that. And if you can reach out to them, if you happen to know any of these families and everything, please choose to do so. We had 175 new positive cases in the last 24 hours. When I would see a number like that, I'd say, well, we didn't test hardly any, but we've evidently tested quite a few because our daily positivity rate was 5.44, and with a number as low as 175 new positives and everything, that rate should have been considerably higher and so we've evidently tested a good many. Our positivity cumulative percent is at 5.12. That continues to fall. That's good. Our active cases are 6,296, and our recovered cases are 149,585. We still have 254 people that are hospitalized and 83 in our ICU units, and Hampshire still remains a red county. We need to get them out of that, that's for sure. Again, a reminder, all 65-year-olds, I've said it 1,000 times, please go get tested. If you have any symptoms of any bad feelings at all, go get tested. If by chance you were to happen to come back positive, we can give you these antibodies and save you a lot of grief, a lot of misery, and absolutely could very well save your life. From the vaccine eligibility, now we've gone to 12 years old and older. Throughout all of our state, we've got plenty of supply at many locations and everything. Absolutely, go and get vaccinated. You know, from the standpoint of our 12 to 15-year-olds, the FDA and CDC have both authorized the Pfizer vaccine for emergency use for age 12 and above. 15 county school systems are scheduled to hold clinics this week, and all these clinics will offer vaccines to all eligible West Virginians, including other students, parents, and all educators. So just remember that just because this clinic is for the 12 to 15-year-olds, it's not necessarily just 12 to 15s. It's for anyone that chooses to show up to be vaccinated. Again, I am absolutely still going to be leaning on and trying to call upon everyone to especially help me with the 16 to 35-year-olds. Absolutely, all those folks that are out there and everything need absolutely encouraged in every way because they can be true patriots stepping up and getting this vaccine. We're still going to work towards, finalizing all the different wrinkles and everything in regard to the $100 savings bonds or the $100 gift certificate. Everyone 16 to 35 years of age will be receiving that. And I'm looking at from the standpoint of the 12 to 15-year-olds and including them in that as well. The vaccine distribution update, we're at 84.7% of the administrative rate of first and second doses. Our goal is always 100%. We're at 72.5% fully vaccinated of all those age 65 and above. Over a third of our population now has been totally vaccinated, and get these numbers right here. Here's the real numbers, okay? The fully vaccinated of all of our people now age 12 and above. And when you brought down and when you started with the 12 and above, you've got to understand that there's 78,000 of those, and none of them were vaccinated until the latter days of last week. And so, right now, the total vaccination rate on the 12 and above is probably 10%. And so that affects the total, and it brings down the percentage of the total. But our total in West Virginia right now that have received one shot is 54.2%, and two shots, fully vaccinated, 45.1%. We're going to continue on this pathway. I feel absolutely certain by June the 20th, we'll have this one shot right at the doorstep or above 65%. That's what we want to do. That gets us there. All of our medical team says that gets us there, and we're good to go. And we're going to meet that 20th, the June 20th date and everything to be able to get rid of these masks. And if we don't meet it, we're going to be close enough. We're getting rid of the mask on June 20th, period. From the standpoint of the saving our wisdom, and I get this number. Remember, 65 years of age and older, we targeted 70, then we targeted 75% of all the people. If we could get all those 65 and older, 70% vaccinated, or 70% of them vaccinated, oh, what an accomplishment that would be. Then we said, no, we're going to go to 75. Then I said, no, bull feathers, we're going to go, absolutely, we're going to go to 85%. That number today of 65-year-olds that have received at least one shot, and there's no way in the world that people that are 65 are only going to get one shot. They're going to be fully vaccinated. But that number right now is at 81.6%. That's our call to arms. I mean, that's such an accomplishment. It's unbelievable. I thank everyone out there for all the good work that they've done. I mean, that is an amazing, amazing number, and we're on our way to get to 85% of our very elderly and 65 and above. Those are the people that have died over and over and over. But there's so many different. It can affect all kinds of others and everything, and then the younger people can sure be transmitters in a big way. We all know all this, but what an accomplishment! 81.6% of all West Virginians 65 and older have right now got their first shot. That's really good. We're shooting for 75% of those that are 50 to 65 years of age, and 65% of everybody. And so we're just. My last little thing here says, if you're 65 years of age and older, and you're still waiting on someone to call, or you're on a wait list or whatever it may be, and you're waiting on getting your vaccine, just call us. Call us on that number right there, and we'll get to you immediately. From the standpoint of our businesses, manufacturing, churches, and everything, setting up clinics and everything, please just call us. We'll come and do your congregation. We'll come and do your employees. We'll come in a minute. From the standpoint of our state parks, we're just continuing to hold, our ongoing efforts to be able to vaccinate at our state parks. And over Memorial Day, we'll be at all of our state parks, all of our West Virginia state parks and forests, and we'll offer the vaccines to everyone, but especially to employees, families, and park guests. And we'll be doing it all outside. All the details should be up right there. West Virginia State Parks, or WVACCINATE.WV.GOV. Okay, from the standpoint of the vaccine info line, it's all up there. From the standpoint of what we did on Friday in regard to the mask, I announced Friday that we are now following the updated CDC guidance on masks. Anyone who is fully vaccinated can participate indoors or outside without wearing a mask or physically distancing, regardless of what the crowd size is. I've had so many people, come to me and say, thank you, I'm so happy to have, one of our state troopers said to me this morning, he said, Governor, it may not be a big thing to a lot of people, but I was able to go shopping. I went in Kroger's over the weekend and everything and didn't wear my mask, and to be perfectly honest, it felt good. Well, I can understand that wholeheartedly, and that's really good stuff. Now, I want you to understand wholeheartedly that this policy is based on the honor system. So I encourage all West Virginians to get their vaccine so that they can no longer have to wear the mask. This thing can slip back on any of us, and just also remember that any private businesses can require you to wear a mask, and whether you can come into their private business or not. Now you can jump up and down, but that private business has every right to do what they choose. They are a private business, and we're going to honor that in this great state. From the standpoint of our Shots to Arms or our Call to Arms initiative, our mask mandate will be lifted on our state's birthday, 158 years of this great state on June the 20th. By that time, using the incentives that we have put in place and potential other incentives that we have in the pipeline that we're working on right now, we anticipate absolutely all those that are 12 and older, that we'll have 65% of the West Virginians fully vaccinated, or with one shot rather, on June the 20th. 75% of the 50 and older population, and 85% of the 65 and older population. That's our goals. We're going to stick with it, and I love it when we try to put a mark in the sand and we try to stay with it. Now we all have to know we've all got to be on our toes, willing to move with whatever we have to move with in regard to this terrible pandemic, because we don't really, any of us, know for certain. But absolutely, we've pivoted the right way at the right times in West Virginia. You've done amazingly well, West Virginia, and I'm really proud of you. I encourage you all to continue to take advantage of our free testing. I was just tested again the other day. I've probably been tested 15 times now. It's no big deal and everything, but I think, that if you have any concerns whatsoever, get tested. From the free testing map, it's all up there, from the drive-through pharmacy and everything. We continue to thank Proof and Walgreens so much for all that they've done. They've been great. From the standpoint of the long-term care facilities, we have 16 total outbreaks now in our long-term care facilities. We have 9 active outbreaks in our churches in 6 counties. That's Greenbrier, Hardy, Jackson, Nicholas, Wetzel, and Ritchie counties. At corrections, we have 10 inmate cases and 4 staff cases. It's amazing, amazing, good work, great work. And I encourage you about giving blood. I say it over and over, but if you've had the blessing from God above to have had this thing and gotten over it and everything, surely you ought to at least consider. You ought to at least consider the blessing that you have to think really hard about. If you can give blood, please go do it. From the standpoint of our dashboard update, starting this week, we will begin updating our DHHR COVID-19 dashboard Monday through Friday only. And today you will notice that the COVID-19 dashboard has been updated to display the 12 and older population and percentage. This change reflects the approval of 12 and older being able to receive the vaccine. You will also be able to navigate through each county to see the 12 and older population and doses that have been administered. From the standpoint of the unemployment benefits and the unemployment bonuses, Friday I announced that we will end all federally funded pandemic unemployment compensation programs in West Virginia effective June the 19th at midnight. West Virginians have access to thousands of jobs right now in this great state, and we need them back to work. Our small businesses and our economy depends on it. Now look, I'm not talking to someone that is out there really struggling, really trying to get back to work and everything. I am not talking to that person. I'm talking now to the people that are out there that have decided, whatever it may be, to be able to take the bonuses from the federal government and to just ride along. I think you need to be back to work. We need you back at work. Our small businesses depend on you so badly, it's unbelievable. Now, absolutely, it's time to take advantage of all the different things that are out there and available to you and get back to work. We're also considering, we do not have it finalized yet and everything. I hope we'll have all this wrapped up and finalized on Wednesday, but we're strongly considering matching with any company that chooses to do so. If a company decides that if we put up 500, they'll put up 500. We'll basically have an incentive bonus of $1,000 for anyone that comes back to work and works at least 90 days at that job. This is not a trade-off, to where you can jump from one company to another company, where you're working today and jump to another company and pick up the $1,000. This is for someone that's been out and will come to work and be back to work. And it's a shame in a lot of different ways, but at the same time, we know that, by taking away some level of potential businesses, this will help, and this will help your family as well. And so that's really good. Our summer feeding programs, and I want you to pay really attention to this. Superintendent Birch and all of the board and all the folks all across our land in all 55 counties, they do an amazing job. Our superintendents and all of our teachers and stuff, service personnel, they've really done an amazing job. But for our second summer in a row, all 55 county boards of education will be participating in the USDA Summer Food Service Program. All 55 counties are providing summer enrichment programs, which include transportation and meal service. County boards of education account for 375 planned meal service locations for our children this summer. To date, 29 community organizations have enrolled to operate meal service locations this summer, which will add approximately 50 additional sites where meal service is available to our children. It is truly amazing, but literally hundreds and hundreds of thousands, even millions of meals that absolutely these great people have gotten to our kids all across the land. I mean, really, when it really boils right down to it, there's too much sadness. There's just too much sadness. And for our kids especially to not go hungry, I mean, it's what we ought to do. I mean, it's just us and what we should do. I mean, there's enough tragedy all around and everything that we surely don't need people going hungry. The Department of Education maintains agreements with institutional and family daycare home sponsors to operate federal child nutrition meal service to children. Currently, there are 3,522 participating child care sites throughout the state that are providing care and meal service to children. This includes operations during the summer. I want again to say special thanks to our State Board of Education under the leadership of a good buddy of mine, Miller Hall. Absolutely, President Miller Hall, and I love saying President Miller Hall. Miller and I have been great friends for a long time, and what a job he's doing. And, and all the other 55 county boards that are helping with our kids to make sure that they're fed. And all the great people at the Department of Ed, everybody across the land, again, thank you from the bottom of my heart. Now, I've got just a few more little announcements. This is a biggie. Over the weekend, and get this, we received from the federal government in stimulus dollars $677,744,994 from the federal government as part of the American Rescue Plan. My staff has been reviewing all the ways this money is needed and working on a strategic plan on how we are going to propose that it be spent. Next week, we will begin reaching out to all of our legislature leadership and working together to get this money out to West Virginians that need it. So we'll be working hand in hand with the legislature. I'm happy to do that and everything. tickled to death to be completely transparent and get their approval on whatever it may be, you know, and we're going to work hand in hand, and we're going to continue to move West Virginia more and more and more to the top and everything. And so tickled to death to do that. Happy to have the money. You know, from a standpoint of something surely not so good, but Secretary Bill Crouch lost his mom over, you know, the past few days, and she passed away from a related COVID illness and or a related illness, non-COVID, I'm sorry. And she was 90 years old. I talked to Bill yesterday, and Kathy and I are surely sending out more and more and more prayers, you know, their way, and we express our deepest condolences to the family. But she was going to be 91 in August, and so a great, great, great mom, and so Bill, we love you, we love her, and we sure hate it for you and everything. Now, last thing I have to say is just this. And I think this is really, really neat stuff. Yesterday at 7:30, I was on a Zoom call with the Marshall soccer team and their great coach and great coaches. Just think about this. And we should be blowing this up everywhere, all across our news media in every way. We're on the cusp in the state of West Virginia that Marshall University may very well, they have a real shot, and I'm confident, you know, but at the same time, you know, I'm hopeful and prayerful that they have a real shot of winning the 2020 NCAA National Championship College Cup. They have absolutely been led by Coach Grassi, and what an incredible job he's done. They without question, you know, can bring home a national championship to this great state. Now, get this, you know, just the other night they beat University of North Carolina 1-0. Prior to that, they beat the #1 ranked team in the country, Clemson. And prior to that, they beat the defending champions, Georgetown. You know, the game will be broadcast on ESPNU at 8 p.m. tonight, and I encourage all West Virginians to be watching, tuned in, and rooting like crazy for the Thundering Herd to bring home a national championship. They were ranked 10th. You know, and but literally, here they are playing for the national championship, and they have got a real shot. They have already beaten Goliath. They beat Clemson, the #1 team in the state, in the country. They beat the defending national champions, and they beat UNC. They play Indiana tonight, and I'm sure that they'll show up in every way. I'm sure they'll be nervous as they can be, but that's good. That's good. They can use that nervous energy to their advantage and everything. And Kathy and I will be right there watching them and everything. That, you know, someone said to me, well, Governor, you know, I was going to be on the Zoom call and encourage the team last night. I did it and everything. But Governor, is there any chance you're going to be able to attend the game? And I said, good Lord willing, and the creek doesn't rise, I'll be there. And so you know, let's all get together and be united and everything, and root Marshall on to a victory tonight and bring a national championship to West Virginia. That would be phenomenal beyond belief. But nevertheless, that's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and I wanted to follow up on what the governor said, and certainly wishing the best of luck to the Marshall University women's soccer team tonight. That's super exciting and great for the university, great for West Virginia. I wanted to spend my comments talking about the decision that the Centers for Disease Control made late last week about changing some of the guidance for mask wearing indoors. And I think for a lot of people, the decision by the Centers for Disease Control to make the announcement that people that were fully vaccinated and 2 weeks after vaccination did not need to wear a face mask indoor or outdoor was a bit of a surprise. But in fact, the data, the science really supported that. So let me just start off with my comments to mention the following. Number one, these vaccines have been remarkably effective, actually much better than we could have ever dreamed. And in real world evidence, with now well over 100 million Americans vaccinated and well over, a few billion worldwide people vaccinated, we're finding that in different studies, these vaccines are almost completely effective at preventing really severe illness, hospitalization, or death in healthy people and folks over 65. And that includes really with any of the variants that we have currently. So the really good news is we have an amazingly effective treatment. And we also know that, as we are looking in our country, we have sufficient vaccination to be able to vaccinate everybody who is currently eligible, which is all Americans over 12 years old. The bad news, I believe, or the challenge still for us and for the rest of the country, is the fact that we still have people that are worried about these vaccines, about the safety, and Dr. Amjad and others have talked about this at recurring levels. But just know that these vaccines don't cause sterility. They don't give you the virus. There's no microchips implanted with these. They don't cause any problems with your DNA. And so we have these amazing treatments, and we are still challenged with getting these treatments to the people that we know really need them. But if you look at the real world data that the Centers for Disease Control based on their decision about removing masks, in 3 different studies in this country, they found that these vaccines were about 90% effective in protecting you from getting any infection, and about 95 to 97% effective at reducing any illness you might get, even if you would have a breakthrough infection, which is an infection in people that are fully vaccinated and are 2 weeks after the last vaccination. And one in Qatar, another country, which looked at people who were exposed to the variants. In Qatar, about half the cases of COVID-19 come from the United Kingdom variant, and about half of the cases come from the South African variant. And what that study showed was that the vaccines were about 90% able to reduce infection. That's not severe illness, that's infection, for the United Kingdom variant, and about 75% good at blocking infection with the South African variant, and still very good in protecting people from having serious or life-threatening side effects. So we also believe, as the governor has said through the whole pandemic, that we want to return as many of the liberties and normalcy back to folks in our state as quickly as we can, and that is safe. And what we would say to people who are watching or listening, or who will watch or listen, is that, we now have different guidance from the CDC, and that's based on scientific and medical information that is being gathered, and that's fantastic. We see the lowest number of cases in the US today since April 2020, which is also great. Deaths are coming down across our country. But in West Virginia, we still have a few places where spread is higher. We know that younger people are spreading faster than older people are right now, particularly our sort of 10 to 29-year-old age group. And so we really encourage all people that haven't been vaccinated, please choose to be vaccinated. But particularly for our younger population, it's really important that we help you choose to be vaccinated, because it really does allow you to do more normal things again, as we've just talked about. But also, it helps protect anybody in your family or other people that you might come into contact with, where you could spread one of these viruses to them. And as we look at West Virginia, we should be very, very proud of what we've done, of the governor's leadership, of our leadership group, but really every West Virginian who's stepped up, who's run to the fire, who continues to pull the rope in the same direction. And for each person that's been fully vaccinated and has that 2-week window, also feel free that if you're in situations that you don't feel comfortable around mixed groups of people in stores, even if they don't require it, wearing a mask is no big deal, and it could certainly help protect you more. And so we also want to make sure that we are kind to West Virginians who still want to use a face mask. And that's certainly your right, and we respect that. But I wanted to make sure that we went over the information that really the reason why the CDC changed their guidance and allowed, that guidance about taking off face masks indoors and outdoors, and people that are fully vaccinated, is because these vaccines are so good, so effective, so safe, that basically the CDC says once you've gone through that, you should feel as if you're living in a world where COVID is not nearly the problem that we know COVID is for people that aren't vaccinated. So thank you.
All right, thank you, Dr. Marsh. Next, we'll hear from retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Would also like to send from Amy and I our condolences to Bill Crouch and his family. We'll keep his family in our thoughts and prayers. As the governor pointed out, we had a strong weekend with vaccine administration, particularly in the over 65 community, but also 12 to 17 years of age. Over 3,900 doses to 12 and 17-year-olds. We had over 23,000 doses administered over the weekend from Friday. So West Virginia, you continue to show strong. We need to continue to keep it up. If you have someone who needs a vaccine and you're having trouble getting it, as the governor pointed out, call the hotline. If you're a local restaurant and you want to get your employees vaccinated, call the hotline. We will help you get vaccines. Same for retailers, manufacturers, all others, we will help you. We will have strong presence at a lot of events across the state going forward to get those numbers to continue to move. So let's hope tonight that Marshall University brings home a national championship in soccer, and West Virginia, step up. Let's get the vaccine and let's get back to normal. Let's beat our numbers and let's beat them before the timeline of June 20th. Thank you.
Thank you, sir. Next, we'll hear from Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I also want to wish Bill Crouch and his family peace during this time. I know his mom was not doing well last couple of months, and he's just hoping he's having some time with his family right now. I do want to remind everyone that the COVID-19 vaccine is available in all 55 counties right now for anyone 12 years and older. Our health departments, community health centers, pharmacies, they're all available to give the vaccine to anyone who would like it right now. You can visit vaccines.WV.GOV and enter your zip code, and it will tell you locations across the state for the vaccines. If you can't have internet access right now, or it's just difficult, there is a phone number that we also have. It's I have to look it up real quick. It's 833, and Jordan put it up on the screen, 734-0965. But you can call that hotline as well, and we can help you find the vaccine. But we do encourage everyone to get the vaccine. As Clay mentioned, it's very important to get back to normal as soon as possible. Thanks, Jordan.
Thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers. This is kind of a very, very meta question. I don't know if you'll have an answer for it. I think my colleague, Evan Bevins, has reached out to DHHR to get an answer on this as well. But we were noticing, particularly with Doddridge County, that there was a big drop-off in the number of fully vaccinated people. As of 5/02/21, it was shown around 38.9%. At its height, it was about 40.9%. And then as of May 17th, it dropped down to 26.9%. And I know obviously adding the 12 to 15-year-olds dilutes those numbers a little bit, but we kind of thought that was a little bit of a pretty sizable discrepancy. So I didn't know if that was something that that something that the experts are at the HHR were looking into, or could explain that and explain if there's any other discrepancies based on adding the new 12 to 15-year-old population into the eligible numbers? Thank you.
Dr. Amjad, this has got to be you or General Hoyer, one of the two of you.
Yeah, Steve, I would have to look at those, and it could be because we've added some of the younger population into that. Doddridge County is also one of our smallest counties, but adding some of the additional ages, like you mentioned, I would have to look at that carefully before giving you a clear answer on the percentages. But it is one of our smallest counties, and adding in the younger age group. But I'll get back to you with a clearer answer on that.
All right, thank you, Steve. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Go Herd. Governor, I know you just got the money in whatever bucket it may be, the latest round of federal dollars, but I wonder how much you can expand on that already. What are the limitations, according to your understanding, of what the money can be used for? Is it still meant to be specifically for revenue losses, for sewer, for water, and for broadband? And how do you think the legislature will participate? Do you think it'll be somewhat formal or more of an informal taking their input process? Thank you.
Well, Brad, we just got the money in this morning, but I can tell you we've done a lot of research into how the monies can be used and everything, and it will be formal on how the money will be appropriated. We're continuing to work with the leadership, the House and the Senate and everything on all those things. But Brad, you asked, you said, will this go? Will there be dollars that go to broadband? Will there be dollars that will go to backfill revenue? Will there be dollars that will go to infrastructure and everything? And all that is and I don't mean this in a smart aleck way in any way, but that goes back to, sir, do you like your eggs scrambled or fried? And the answer is yes, because Brad, I do think by what we have seen so far is the regulations on how you can dispense and use the money have even been relaxed even a little more. So the net of the whole thing is these are what they're called. They're called stimulus dollars, and they're there to do that, to stimulate our economy and bring our economy back to life. But we'll be working hand in hand with the legislature and hopefully move this thing forward.
All right, thanks, Brad. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor, and good afternoon, cabinet members and fellow reporters. First of all, my condolences to the Crouch family. I had to bury both of my moms in my lifetime, and it's not an easy thing. And Bill is a great man and has done a great job for West Virginia. So I send my prayers and condolences to the Crouch family. Also, I want to mention we have a crew on scene in Cary, North Carolina, as we speak, that'll be covering the soccer game for us tonight. And so we invite folks to tune in. Governor, here's my question today. I've been talking to some small business owners, and while they like the idea in theory of what you're talking about, where the state kicks in $500 and the private business kicks in $500, quite honestly, these small businesses, and I'm talking about 2 restaurant owners, they have been working at the margins. They're barely keeping the doors open. And so what they're telling me is the last thing they have on hand right now is an extra $500 for bonuses, especially if they're going to hire 4 or 5 employees. They're going to have to come up with $2,000, $3,000 in one hit, and they just don't have that kind of money. And they're wondering if there's any flexibility, if maybe the state through the CARES Act and the Restore America Act funds could pay for the whole $1,000 bonus.
Well, Mark, that's what we're looking at, because you're exactly right. And to all those small business owners, that's exactly what we're looking at. Because here's the deal. You've got small businesses that are hurting and trying to come out of this recovery. And when you're asking those small businesses to step up, some small businesses are just doing great, doing absolutely great, and they have the funds to be able to fund the $500. But how do you discriminate? And I'm surely not about doing that. And so So with all that, you're splitting the bullseye right here. Is how are you able to incentivize those that have been out of work and compensate them and help them and get them back and do so, with the same situation to where you have small businesses that are really hurting, and asking them to throw in the other $500 is just too much. And so we're going to work this out and everything, but good points, and that's the very reason why we haven't pulled the trigger on this yet. So we'll get that worked out. And from the standpoint of the state carrying the whole load and everything, I think it would be better if the small businesses carried a little bit. Whether that amount is half or not, maybe we can greatly modify all that, and that's what we're working on.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask you about your efforts to eliminate the state's income tax. I know when those efforts kind of floundered toward the end of the legislative session, you said you plan to go out on the road to keep educating people and discussing this issue. When do you plan on taking that back up? Thank you, sir.
Well, Charles, we've been working at it behind the scenes and everything. We've been working with the leadership of the House and the Senate. Charles, I would say this over and over, but I am very, very hopeful that we can get everybody on board before we'd ever even think about going to a special session. From the standpoint of me going out on the road and everything, I am surely willing to do exactly that. And I'm anxious to do that because I love going out on the road. I love being with the people and all that. But Charles, here's the thing. I think the proper channels, we have been working through the proper channels. We've had multiple meetings and everything. And then there's lots going on. There's lots going on, behind the doors and everything, just to try to work, be respectful, try to absolutely, get everybody on board and everything. But Charles, I'll end up by just saying just this, and I don't know how to say it any other way. But what really are we going to do? I mean, and Charles, everybody that's on today, please listen to me, please. Just think about it. We got counted in the census the best of any state in the country. We still lost more population on a percentage basis by multiple times than the state that was 49th in the country. We were dead last so far that the whole nation laughed us, and we were running to the finish line a lap behind everybody for the most part. Now, and we got counted the best in the country. Now, what if we hadn't got counted the best in the country? We would have been so far behind that people would have finished the track meet, packed up their stuff, and left, and we'd still be running. Now, Charles, from the remote worker program, the response for 50 spots was unbelievable. Unbelievable. Now, then the last go-round comes out, with the census when they come out and they say how your state is growing or not growing. And West Virginia, dead super last. Now, on top of all that, Charles, I just said this morning, I met this morning with the Coal Association people, and they were basically saying, they were really worried about what was going on within the Biden administration, and they should be. They were really, really concerned about our coal jobs and our coal miners across this state and everything, and they should be. Now, Charles, when are we going to wake up? I mean, let's just be serious. When are we going to wake up, Charles? We are losing population like crazy. Without any question, we're losing population so badly it's off the chart compared to everybody else. We know that. In addition to that, we know that coal and natural gas are under attack, and oil are under attack today. We know that. And we also know that every day that we go forward and everything in this great state, the stimulus dollars are going to go away. At some point in time, very soon, the stimulus dollars will evaporate. What are we going to do, Charles? What are we going to do? And the bottom line to the whole thing is just one thing, and that is just this. I proposed a system in which we could give every single solitary person in the state of West Virginia more money after they paid any increase in taxes, sales tax, or whatever it may be, more money in their pocket than they have today. I know without doubt, it would bring growth to West Virginia. But you don't have to depend on me saying that. Really, at the end of the day, Charles, if we continue down the path that we're going, eventually it'll get every single one of us. Last thing I'd tell you is just this. I don't know how to make it any easier. If I were to hand you $2,500, and that's what we'd be doing, and then you say, Charles, now you're going to have to give me back $650 or $800 of the $2,500. You're going to have to give that back to me because that's going to cover your sales tax increase or cigarette tax increase or whatever it may be. You're going to have to give that back to me. I'm going to give you $2,500. You're going to have to give me $700 back. Now, Charles, ask yourself just one question. Would you not be better off? And then ask yourself a second question. Charles, do you think the gun shop downtown or the fishing tackle place downtown or the Walmart or the accountant downtown or whomever it may be, dress shop, do you not think they would sell more stuff if you had that extra money in your pocket and everybody had that? Well, of course you would. Of course they would. And at the end of the day, Charles, do you not think that is our only chance in West Virginia, our only chance to turn the dial on bringing people to West Virginia versus people leaving West Virginia, and West Virginia, in other words, just becoming a state park? Charles, if we hadn't been counted in the census like we were counted, we may really only have one congressperson, coming up. We got, cut again, and we're only going to have two. Absolutely, Charles. Do you not think if we lose a whole bunch more coal mine jobs or gas jobs, and it could happen, it could very well happen. Charles, what are we going to do? What are we going to do? We are diversifying our state, and we're growing in all kinds of different areas, whether it be high tech or medicine or tourism. But Charles, this was our chance. This was our chance right here. And we blew it. Now we need to revisit and regroup and work together and not grandstand, work together, me included, House included, Senate included, and get across the finish line with this. Because this absolutely is the very thing that will start West Virginia growing. It will ensure that our schools will do better. It will ensure that our roads will do better. Absolutely, without any question, this is what we need to do. But Charles, the reality of the whole thing is everybody has been, me included, everybody's been dead level focused on getting these vaccines in people's arms because the very thing at hand is saving people's lives. That's what we've been doing.
All right, thank you, Charles. Next, we'll go to Emmy Keenan with WOAY.
Hi, sir. Thank you so much for having me here. So I was reading about the 90 days you qualified for this bonus incentive to get paid this amount of money. What happens if these people want to continue to take advantage of the system, work the 90 days, get their bonus, and then quit? What are we going to do then?
I don't know. I really don't know. We're going to keep on doing exactly what we're doing in regard to the vaccination stuff. You know, if the savings bonds don't work, we're going to keep on trying to come up with any way and every way we can to get people to be vaccinated. You know, from the standpoint of if we come up with an incentive program, and don't take it to the bank on the incentive program that I'm just throwing out there, but if we come up with an incentive program to get people to go back to work, and after 90 days they dive in the ditch, hopefully we'll have good news coming on the our personal income tax, that we'll have a bunch of folks looking at moving here. I am telling you without any question in the world, you can't imagine this, you know, but I am told this over and over and over from real estate folks or whomever it may be, calls coming in from all across the nation. I mean, just imagine we probably had 10,000 people not just visit the website. We probably had 200,000 or 150,000 or whatever it may be to visit and look at West Virginia through the remote worker thing for 50 spots. 50 spots. Now, if you had 150,000 for 50 spots that looked at us, and then on top of that you had 10,000, right at 10,000 that spent an hour filling out an application to come to West Virginia from every state in the country, plus from, I think, 6 or whatever foreign countries, but 10,000 of them spent an hour of their life to fill out an application to come to West Virginia for 50 spots. Now, think about that. Think about that. You know, what I would say to your question is this: if after 90 days these people want to go home and sit on the porch, let them go home and sit on the porch. Hopefully we'll have a bunch of people coming to West Virginia, and hopefully they'll be coming, you know, really wanting to work and happy to work, because I really believe this. You won't get me out of this. I believe the good Lord above expects us to work. And to me, I'm all about work. And so yeah, I don't know what we'll do after 90 days, but we'll keep on trying to do anything we can to help those folks and get them back to work.
All right, thank you, Emmy. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. First to Secretary Crouch, appreciate your efforts during this tough time of doing your job while losing your mother. I know that's been tough, and I appreciate you. Governor, I have a question about the incentive program and even why it's necessary, because if you're cutting off the unemployment benefits on June 19th, the people that were basically gaming the system would necessarily have to go out and find a job anyhow to live if they didn't have the money coming in. So why are we putting up money to reward them basically for gaming the system? Thank you.
Paul, it's not only a great question, you know, it's a great statement, you know, but Paul, just to tell it like it is, in any time you have any level of program, somebody's going to game the system. You know, that's just what they do, you know, and so with all that, we're trying to work within the guidelines of the programs and absolutely trying to encourage them to come back. Now, they're not going to lose all their unemployment stuff if they legitimately lost their job and everything. They're just going to lose bonus dollars. But Paul, you know, it's you know, damned if you do, damned if you don't. You know, you've got small businesses that are crying to the heavens and saying, we got to have people come back to work. We can't hire people. I mean, for crying out loud, our business is still really suffering. You know, we have to close at 8 o'clock at night because we don't have enough people to be able to keep the doors open, or we absolutely can't run on the way we're running, on full capacity. We can't run on 40% capacity because we don't have people here to be able to do the jobs. Now, so you're trying to surely help them. And you're also trying to help those that are out there that maybe are gaming the system. You're trying to find a way to help them too. It's tough. In this job, there's a whole lot of tough decisions. And you're opening yourself up to get criticized in a lot of different ways. But I'm a full believer that you've got to keep going north. You've got to keep the boat moving. And to just sit on your hands and do nothing and everything and watch the boat just kind of spin around in a circle, that's not an answer to me.
All right, thanks, Paul. Next to David Beard with the Dominion Post.
Hi. My COVID question was already answered, so I'm going to ask something else that I've been asked by people. During the legislative session, both the House and the Senate passed resolutions urging the governor to form a task force with our federal representatives to seek some solutions for the closing of the Milan/Beatrice plant, whether it be repurposing it or finding another buyer. And I wanted to, and I know the governor, you said previously that you don't have the power to invoke the Defense Production Act, and I understand that, but I wonder if you've taken any steps along those lines of creating a task force or taking any other steps that on this issue. Thanks.
David, the easiest way to say this is there's no point in me going blow by blow about all that I'm doing, all workforce is doing, all the Commerce Department's doing it, but I can promise you everybody is working this and working as hard as we possibly can. We've not found a solution yet, but it doesn't mean that we're not continuing to work on it and everything. And y'all may think, well, gosh, he's so hung up on this personal income tax. Would that have not helped? I mean, really and true, would that have not helped in recruitment of people and bringing business to West Virginia? Would that have not helped in an amazing way if we had to promise in West Virginia to get rid of our state income tax? Would that have not helped bring a lot more looks? And it's just not beating, a dead horse in regard to the income tax situation. In this situation, we have tried, and we're going to continue to try in every way, because those folks, and there is a pile of them and everything, those folks need employment, and those jobs were great jobs and everything, and are great jobs, but we haven't found a solution yet. And I've got Commerce and Workforce and all of us working on it like crazy, but we haven't found a solution yet.
All right, thank you, David. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Regarding the suspension of the unemployment federal supplemental benefits, my understanding is next month, Workforce West Virginia will start reinstating the work requirement for unemployment. Wouldn't that be sufficient to find the, as you say, the people who are gaming the system and still continue to provide the needed benefits to the people that you, as you said, are hurting out there? And also that by suspending the federal funding, we're taking about $7.2 million a week out of the state economy, which doesn't seem like a great idea in the middle of a pandemic.
Well, Phil, to answer your question, I think you need both. From the standpoint of more and more states that are going this way, they are. And from the standpoint of taking dollars out of the economy and everything, from the standpoint of what they're going to contribute to the economy, if we subscribe to that philosophy of just what you just said, well, the easiest way in the world we could just stimulate the economy is just send everybody $300 a month and everything, or $300 a week, and that would do it. But those people are vital to our system, and those people generate all kinds of great things that are happening within our economy. You know, wages are driving our economy, but there's so many other things that we need them for. And so no, I don't think just sending them a check is going to be harmful to the economy. In fact, I think dead the opposite. I think if we can get them back to work, it'll be terribly beneficial to our economy and especially our small businesses. So I think we need to do both, and that's what we're going to do, because I think other states are seeing that light as well, and many of them are moving that way. I do want to add just this, though. My whole comments are not directed towards, somebody that's really genuinely trying to go back to work and somebody that's genuinely having a tough go. I think we've tried in every way. We've stepped up when a lot of states didn't step up. If you'll remember, when President Trump did his $400 a week, $300 of it was paid by the federal government, and then it was a decision whether or not for the state to step up and do the other $100. We did. I think it cost us, I don't know, tens and tens of millions of dollars, but nevertheless, I've always been one to step up, and that's what I'm going to do. But in this situation, people need to get back to work.
All right, thanks, Phil. Governor, back to you.
Okay, I only have one thing, and I just made this comment, wrote this comment down and everything as I was, we were going through the briefing, but, and maybe one of the experts or somebody, said something about this, but I want you to just, I want to talk to the people that have not been vaccinated. And this will be very quick, but I assume every last one of you is a smart, absolutely articulate, good person, good to your beliefs and everything in every way. I want you to ask yourself this question. Ask yourself this, that 2,762 people have died. 2,762 of them have died. First, ask yourself, how many of them died that were vaccinated? And that number is so minuscule it's off the chart. I think you can count that number on your one hand. But now just think with me. 2,762 people died. Of those people, how many of them, if they had another chance, how many of them would have run to have taken the vaccine? I bet it's almost every single last breathing or non-breathing now, one of them. I ask you just this. Ask yourself just this last question. We've lost 2,762 people in West Virginia. What if we had all of our people vaccinated? How many people would die? 10? 12? How many people would have died? And absolutely, how can you deny those numbers? Of those 2,762 people, we owe them a lot of respect, don't we? We owe them a lot of honor. We absolutely don't need to snub them and think those 2,762 people died for nothing. They died in vain. 2,762 people. I want you, if you haven't had your vaccine, to just think about them. And think about just the questions that I ask you. I ask you this, of those 2,762 people, how many of them died, and had their vaccine? I think you can count them on one hand. And then I ask you the next question. I said, of those 2,762 people, how many of them, if they had another chance, how many of them would have run to have taken the vaccine? And I bet it's every single last one of them. And then I ask you the last question, and it's just this. If we had the vaccine all along, how many of those 2,762 would have died? If we'd have had a vaccine all along and not compelled any of the 2,762 to have taken the vaccine, how many people in West Virginia would have died? It wouldn't have been anywhere close to that number. I can't tell you what that number would have been. But if that number would have been 1,000, we would have saved 1,762 lives. You got to take the vaccine. Because if you don't, that number is going to continue to go up. And the next time you hear from me and everything, that number could be who knows what. If you'll wait and you'll wait until September, and then you'll hear from me in September, I'll bet you that number will be over 3,000. You may be one of them. Absolutely, without any question, one more time. I'm going to ask three questions. First of all, of those 2,762, how many of them would have absolutely, if they had the chance right now, if God said right now, I'm going to put you back on earth and I'm going to give you this chance to make the decision, how many of them would take the vaccine? And I'll bet you it would be all of them, without any question. I'm not going to go through the three questions again because I'm just going to ask you just one more. How many of their loved ones, how many of their friends would love to have them back? It's all of them. It's all of them. So absolutely, come on. Come on. Don't be the next casualty. Go get vaccinated. Don't sit back and watch others die. Come on and help me. Come on and help your neighbors and all your loved ones. Absolutely, over and over and over, we are pleading with you to get vaccinated. Do so. Remember, I love all of you. I really do. And I'm absolutely respectful of all of our rights and opinions and everything in this great state. But we need you. We need you really bad. We need you to go get vaccinated. Thank you so much.